answer that question would be to prioritize yourself and your training and your welfare. It can feel a lot as an FY1, and sometimes you do feel like you have the weight of the whole hospital at your shoulder. But I think the thing to remember is that you're part of a team, and you're part of a team of people that a lot of them have a lot of different experiences, and a lot of them are more experienced, and they're there to help you as well. So if you feel unsure about anything, escalate it up quite quickly. Ask a senior. There are no stupid questions in FY1.
I probably wish someone had told me not to worry about the future so much. Throughout medical school, you spend so much time worrying about whether you're going to finish, and when you get to foundation year 1, there is this sudden hurry to know what you want to do with your life, know what you want to do when you grow up. I think my biggest piece, or what I wish someone had told me, is just to kind of live in the moment, enjoy the moment. Yes, it is important to start getting things ready for this future speciality you want to apply to, but you're always going to have to get something ready. So enjoy the moment and don't spend all your time being anxious about the future.
So the different ways in which you can manage stress, one of them is by debriefing with your colleagues. So anytime there's been a stressful situation, afterwards, just having a quick chat with your colleagues. It doesn't have to be a formal debrief, but something informal really helps to de-stress and helps you to reflect on things as a group.
Give your bleep to someone when you need to go to the toilet. I know that sounds ridiculous, but the bleep will go off relentlessly when you are on call, and sometimes you just need to go to the toilet in peace. Go out with your friends when you can, relax when you need to, have regular meetups. I know things are not the same because of COVID. Have a Zoom meetup where you and your doctor friends can basically moan about the kind of days that you've had, and you can get it off your chest what you're really upset about. Talking is therapy, trust me.
I would say asking for help early as well. That's really important. You asking for help early lets people know that you're feeling quite stressed, and that can also help you manage things a bit better. And I'd say in terms of managing stress, it's also important to keep your hobbies outside of medicine. I know that starting work can be a time when a lot of things try and slip away, but if you keep a work-life balance, you'll find that both your work and your personal lives will benefit as a result. Number one, try and look at what the consultants around you are like, because the consultant part of the job is where you're going to be spending 30 to 40 years rather than 4 months as an FY1 or 4 months as an SHO. We get drawn to a specialty because of the cool and exciting things, but actually those are the things you do in a minority of cases, and it's whether you could go and do the same things for 30 years and not get bored or not get frustrated. And if you can do that, then that's a good sign. If you can't do that, then it might be worth considering other specialties. Essentially, it's about ticking the right boxes and looking at your CV, comparing it to the portfolio requirements, and going off against that. So for example, if you want to do surgical training, you'll look at the core surgical training portfolio, which is online, and from that you can then look at your CV and say, look, do I need some more points in teaching? If so, how do I achieve that? I think people get very caught up in things like publications and the things that are very hard to achieve, but the most efficient way to improve your CV is to essentially do the easy things. So have you done any teaching of med students? Have you done a good quality improvement project? Have you presented that quality improvement at a local meeting or regional meeting? So if you were to do like a quick 2-cycle quality improvement project, you present it at a meeting, you win a prize at that meeting, that gives you way more points than doing a PhD. think the most memorable moment for me is, I guess, when you have a patient who you didn't think was going to make it, who was in a bad way, and everyone comes together, things happen, and they come out of hospital a completely different person.